Good evening, everyone. I'm Dr. Rohan Khandelwal, your Marrow Surgery faculty, and it gives me immense pleasure to introduce Dr. Dinesh to all of you. Dr. Dinesh has secured an amazing score of 244 in the recently conducted FMG exam. Heartiest congratulations, Dr. Dinesh. We all from the Marrow team are extremely happy to see your score. Heartiest congratulations.
Thank you so much, sir.
So, Dr. Nish, tell us about yourself. Where did you do your MBBS from, and how has the journey been with Marrow over the last few years?
So, I did MBBS from Davao Medical School Foundation, Philippines, sir. And
Hmm.
I started my journey in my second year. So I bought Marrow Plan C in my second year. My senior and my friends, my roommate, recommended it. So it was really a wonderful journey, sir.
Great. So, Marrow has been your primary source of preparation since second year, and you've been watching all the videos on Marrow through Plan C. Tell us what you like about Marrow, who your favorite faculties are, and how did you go about preparation? Did you make your own notes? Were you reading the notes which were provided by Marrow? So give us some insights into your preparation journey.
Uh, Actually, I my senior recommended and my roommates also recommended Marrow Plan C, sir. So they said our schedule was so tough, sir. So like very crumpled. So per per day one video or two videos. If we manage, we can complete by Marrow by fourth year. So that was my initial plan. So it took more time, sir. But it was really a wonderful journey. My favorite teacher is of course you, sir. And also I really like Rakesh Nair sir and orthopedics bone surgeon. He is also very good. Orthopedics he made really simple. And also Marrow is being my primary source for entire 3 years, sir.
That's great. So you used to watch the videos, Dr. Dinesh, and were you using ready-made notes or were you making your own notes while preparing?
Uh, I bought ready-made notes from Marrow, sir, in my third year. So I was using that, and also few for uh, few subjects I made my own notes.
Yeah, perfect. And Dr. Dinesh, I mean, Philippines has been known to be one of the better places for FMG in terms of academics. They are very academically oriented. So, what would be your advice to students who are preparing there to keep on attending the college lectures? Simultaneously, you are using some source for preparation, but you should not miss out on college lectures. And were they useful as well during your preparation?
Yes, sir. Actually, Marrow is the best for college exams also, sir. Actually, we had MCQ oriented exams, sir. So it's mainly tested on concepts, sir. So I used Marrow as primary source for even for my college exams also, sir. Especially the clinical subjects, it was really helpful, sir. So like if we do one videos or two videos per day, we can complete Marrow by fourth year. Also, it helps in college exams also. Plus, it helps in uh, for entrance exams also, sir. So I really recommend.
Great. So, Dr. Dinesh, you said that your university exams were also MCQ exams. So,
Yes,
simultaneously, after watching the videos, were you also doing the Qbank?
yes, sir. Of course, sir. Mainly for
Okay.
clinical subjects, sir. But if the exam is very near, it will be like very tough, sir. But I really love Marrow Qbank, sir.
Hmm. So, you basically used to finish one subject and used to watch the Qbank or solve the Qbank for that subject then.
Yes, sir. I usually used to watch video, then and there I will do Qbank, sir.
Great. And were you using the Qbank of the FMG section or the PG section?
Sir, PG section, sir. For last 3 years, I used only PG section, sir. When the
Great.
exam for the last 6 months, I was using FMGs.
So that is very interesting, because I've been teaching FMGs now for almost 13, 14 years. And one thing which I've seen over the last 6, 7 years is how the scores have increased. When we started teaching, A, the pass percentage wasn't good, and B, the highest scores were somewhere in the 170s, 180 range. But now you see that the highest scores are reaching 244, 246, 248. So that basically means that students are preparing in a better manner. FMGs have, increased their level of preparation and their standards have increased tremendously. So hats off to all of you guys as well for taking the standards so high. And I feel that the competition, you people are much more aligned to appear for a PG exam and crack a PG exam also this way.
Thank you so much, sir.
Yeah. So did you appear for the mock tests and the subject-wise tests which are highlighted in the app?
Yes, sir. After completing each subjects, I will be doing subject-wise test to like a pre-test and post-test, sir. First, I will do subject test, then I will do like do the revision videos for the FMG exam. Then at last, I will do on post-test like subject test, and all the mocks I attended, sir.
And what about the mock test which was held, the national mock? What was your score in the FMG national mock?
So my score was rank 30 in part one and rank 22 in part two, sir.
Rank 22 in part 2. But what was the score? Do you remember your score?
And my score was 110, 110, sir.
110, 110. So 220 was your score then.
Yes, sir.
Great. So you've upped your score from the mock. The mock was a good indicator of where you stand. And before we started talking, you told me that you were expecting a good score. Of course, 244 was a surprise for you, but you
Yes,
were expecting a good score after the exam.
yes, sir. Definitely, sir. The Marrow mock test was really good, sir. I attended all the mock tests live, sir. Actually, the questions were really good, sir. I can easily understand. It was structured very nicely, sir. So I really love Marrow Qbanks.
And how was the FMG exam this time? Some students said that it was very challenging. There were new images. What was your take regarding the exam this year?
So part one was very easy, sir. Like it was like
Hmm.
one-liners, and it was like easy. Like even like the national mock test, sir. Many questions came from that, sir. Like around
Okay.
50 to 60 questions directly from the mock test. And also part two was mainly very confusing, sir. Like maybe like two or three will be the answer, sir. But it was we had to choose the best from that. So it was like that. It was like
The options
all
were
the
confusing.
yes, sir. All the options are like so it was the correct. It was the correct. So it was very confusing, sir. It was, but part two was like many radiology, sir. Around 50 questions for radiology images was given. So I attended using that radiology images only, sir. It helps. It helps in the radiology helps in the solving the questions, or else it will be very difficult.
Did you solve grand tests during your preparation journey?
Yes, sir. For last 6 months, I did all online, all the grant tests online. So around 13 to 14 I gave, sir.
Okay. So, Dr. Dinesh, a couple of tricky questions for you. Number one is that FMGs usually find it difficult to revise, to summarize, or to revise everything in the last few months. How did you go about your revision?
So actually, I graduated in Feb 25, sir. So my plan was 3 months of one best revision and 1 month of very solid, concise, very important oriented, sir. So first 3 months I was giving like all the revision videos was my main source, sir, plus PVQs plus I watched that video like TND, sir. And for last 1 month, I was mainly PVQs and I was like very consolidated like notes like which is important for FMJ like that.
So basically, revision videos, PYQs, and the question discussion videos which were there.
Yes, sir.
Okay. Now, some students, message us and say that we don't want to watch the main videos. There is still time. They still have 6 months, 8 months, but they say that can we just watch the revision videos? So, what would be your advice to them? That if they have time, should they watch the main videos of major subjects and then go to the revision videos, or only revision videos would also suffice for FMG?
No, sir. At least for clinical subjects like surgery, OB, they should watch the main video, sir. That's part two was very confusing, sir. Like if you didn't do the main videos, it will be like we don't know what topic and what they ask like that. It will be, sir. So at least for clinical subjects, main video should be, sir. At least they should have watched one time for for subsequent revisions. Maybe revision videos will be enough. But for one time, at least they should watch the main videos.
So for the main subjects, the clinical subjects which have a very high weightage, you strongly recommend main videos and then switch to revision videos after that while they're revising. And for short subjects, they can even do revision videos.
Yes, sir.
Okay, great. Did you utilize the pearls as well in the Marrow app?
For biochem and forensic medicine and for pediatrics, this which I used, sir.
Okay. And
especially.
other things which so in the Marrow app, what were the features which you liked regarding the Marrow app?
Mainly the Qbank, sir. The three options, it was really good, sir. Plus also the Qbank, the app was so smooth, sir, to use. So I really love that. It was so
Great.
simple, also, sir. Like everything is like in place, so we can easily go and search. It was very good, sir.
That's amazing. And what would be your advice to your juniors in Philippines? What advice would you like to go while they are preparing for their FMG exam?
So I would recommend to buy Marrow at yearly, sir, like from second year, first year. So the schedule is very crumpled, very tight, sir. So even they can watch one video or two videos per day. They can able to manage by fourth year. They can complete the entire syllabus, and for online platforms like Marrow, it is really useful, sir. So it will be helpful also for the intense NEET PG also, sir. So
And
I
did
would
you
recommend to buy
participate
yearly.
in the marathon, which we used to organize for solving the QBank modules?
Was I didn't attend this trip because the schedule was so I want to
Hmm.
complete very fast. So I was mainly last 6 months I was focusing on only on PVQ, sir.
Great. But when it comes to FMGs, what would be your advice for them to stay motivated when they are abroad? You know, they're homesick sometimes. How do they stay motivated and how do they keep studying?
It was maybe attending some YouTube sections. Like I saw many YouTube sections like they're so giving some motivation speech, maybe like that, or maybe they should speak with their family more often to get motivated, sir. But it's really very tough to get motivated in FMGs.
No, I understand. I mean, staying away from home for so long and going through a rigorous MBBS tenure can be quite challenging. And you need a good friend circle and family support to uh, make it through these 5 or 6 years. So, thank you very much, Dr. Dinesh. Thank you for talking to us. It's been an absolute pleasure. Love the focus which you have, love the clarity of your preparation, and heartiest congratulations once more. And I can't wait to interview you once you get your surgery seat in post graduation.
Thank you so much, sir. I'm really grateful to entire Marrow team and especially to you, sir.
All right. Nice talking to you. Take care. Good
Thank you
night.
so much.